Hello everyone, welcome back to my YouTube channel. I hope you're all doing great. Today we are going to talk about one of the most common nutrient deficiencies around the world, that is vitamin D deficiency. Many people think that vitamin D is only important for bones, but that's not true. Vitamin D plays an important role in keeping our bones, muscles, immune system, and overall body healthy. The surprising part is that many people don't even realize they have low vitamin D levels because the symptoms can be mild or develop gradually. In this video, I'll explain what vitamin D is, why our body needs it, common symptoms of vitamin D deficiency, causes of low vitamin D, foods rich in vitamin D, how sunlight helps, who is at higher risk, and simple ways to maintain healthy vitamin D levels. So, let's get started. Vitamin D is a fat-soluble vitamin that helps our body absorb calcium and phosphorus, two minerals that are essential for strong bones and teeth. Unlike vitamins, our body can actually produce vitamin D when our skin is exposed to sunlight. That is why vitamin D is often called the sunshine vitamin. Vitamin D also supports healthy muscle function and contributes to normal functioning of the immune system. Without enough vitamin D, our body cannot use calcium effectively, which may affect bone health over time. Let's look at some common symptoms. The first symptom is frequent tiredness or low energy. Even after getting enough sleep, some people may continue to feel exhausted. The second symptom is bone pain or back pain. Since vitamin D is important for bone health, low levels may contribute to bone discomfort in some people. The third symptom is muscle weakness. You may notice difficulty climbing stairs, lifting objects, or feeling weaker than usual. Another common symptom is getting sick more often. Vitamin D supports the normal functioning of the immune system. Some people may also experience slow wound healing, although this can have many different causes. Mood changes or in feeling low have also been linked with vitamin D deficiency in some studies, but these symptoms can occur for many reasons. Children with severe vitamin D deficiency can develop problems with bone growth, while adults may experience weakened bones over time. Remember, these symptoms are not specific to vitamin D deficiency. They can have many different causes, or proper testing is important. Now, let's understand why many people have low vitamin D levels. The biggest reason is not getting enough sunlight. Many of us spend most of our day indoors, at home, in the office, or at school. Even when we go outside, we wear clothing that covers most of our skin or use sunscreen, which can reduce vitamin D production. Another reason is not eating enough vitamin D rich foods. Certain medical conditions that affect fat absorption can also contribute to low vitamin D levels. Older adults are also at higher risk because the skin becomes less efficient at producing vitamin D with ages. People with darker skin may need more sun exposure to produce the same amount of vitamin D compared to people with lighter skin. Obesity is another factor that may be associated with lower vitamin D levels. Although sunlight is the main source, some foods also provide vitamin D. These include fatty fish like salmon, sardines and mackerel, egg yolks, fortified milk, fortified yogurt, fortified breakfast cereals, fortified plant-based milk, some mushrooms that have been exposed to ultraviolet light. Remember, it's often difficult to get enough vitamin D from food alone. That's why a combination of healthy eating and sensible sun exposure is important. Many people ask how much sunlight is enough. The answer depends on the factors like your skin tone, where you live, the season, the time of the day, and how much skin is exposed. In general, spending some time outdoors with sunlight on your skin can help your body produce vitamin D. However, avoid excessive sun exposure that could damage your skin. If you're unsure about your vitamin D levels or how much sun exposure is appropriate for you, consult your healthcare provider. Some people have a higher chance of developing vitamin D deficiency. These includes older adults, people who spend very little time outdoors, people who always keep their skin fully covered outdoors, individuals with darker skin, people with certain digestive disorders that affect nutrient absorption, people with obesity, infants who are exclusively breastfed may also need vitamin D supplementation if recommended by their pediatrician. If you belong to one of these groups, it's worth discussing your vitamin D status with your doctor. Can vitamin D deficiency be treated? Yes. If a blood test confirms vitamin D deficiency, your doctor may recommend vitamin D supplements. The dose depends on your age, the blood test results, and overall health. It's very important not to take high-dose vitamin D supplements without medical advice because excessive vitamin D can also be harmful. Always follow your doctor's recommendations. Some of the simple tips to maintain healthy vitamin D levels are: spend some good time outdoors regularly, eat vitamin D rich foods, stay physically active, maintain a balanced diet, get regular health checkups if you're at risk, take supplements only if recommended by your healthcare provider. Small daily habits can make a big difference over time. We've come to the end of our video. Vitamin D is an essential nutrient that supports healthy bones, muscles, and the immune system. Many people don't realize they have low vitamin D because the symptoms can be subtle. The best approach is to maintain a healthy lifestyle with balanced nutrition, sensible sunlight exposure, and regular medical checkups when needed. If you notice persistent symptoms such as tiredness, bone pain, or muscle weaknesses, don't ignore them. Speak with a qualified healthcare professional for proper evaluation. I hope this video helped you understand vitamin D deficiency better. If you found this video useful, please hit a like, share, and subscribe to my channel for more health, wellness, nutrition, lifestyle, and travel videos. Thank you so much for watching. See you in my next video. Until then, stay healthy, stay active, and take care. Bye-bye.